There was this video that went viral recently about the Instagram face and how people are looking. Oh yeah,
please.
No, yeah, that's not how it works.
Yeah, so I think it's a little bit of both. And then why is the injector saying yes?
Yeah.
I'm gonna do what's best for you and your face, right? Trends come and go, like but your face will always be you.
Totally. All right, so I have a question.
All right.
I disagree with this, but I want to get your take. So there was this video that went viral recently about the Instagram face and how people are looking similar.
Yeah.
What's like all the celebrities are starting to look the same. Not bad, not like overfilled. Which you're telling me that's not the Instagram face. But what do you think about that? Do you think it looks good?
Oh, here's the thing.
Be serious.
Right. When I was looking at the videos that actually went viral, yeah, I think they're good photos of people. I think those people look good in the photos. But the message was that everyone was kind of morphing into the same face.
Right.
And also, come on, let's be real. These models and Instagram people, they're using filters.
Yep.
They're face tuning like crazy.
AI filters.
Yes.
Yeah.
And like they're preset filters.
Yeah.
So like it's the preset face on their photos.
Yep.
So yeah, they are looking pretty similar.
Mm-hmm.
But taking that into account from like an aesthetic standpoint, is everyone getting the same chin? Is everyone getting the same cheeks? Is everyone getting the same lips? I think trends come and go, yes.
Yeah.
But I've actually thought about this too. Like, I don't think you should put the same chin on, a blonde hair, blue-eyed person on a black African-American person.
Totally.
I don't think that would look good, right? So, but I've seen injectors actually practice that way, where there's this standard, quote unquote, beautiful chin that they'll stick on every single face. And that doesn't look right to me. So I think that's where that Instagram face, quote unquote, is coming into play. But I would hope that that's not what I'm producing in the treatment room at all.
I don't think you are.
I don't think.
No, your results look really good and natural. I think, here's the thing, like we learn these proportions in surgery too.
Like the golden ratio.
Yeah, it's total bullshit.
Yeah, agreed.
And it was probably a bunch of white dudes sitting around picking out what they wanted.
Yeah.
But I also think that we live in a time where you're so easily able to put two pictures next to each other and say these two people look the same and these 8 people look the same.
Yeah.
Like we just haven't lived in a time where one person has 50 pictures of themselves on one day with the same outfit.
It's true.
It's just never existed before.
Yeah.
So when I see those pictures, I actually think they look nice. I think they look proportionate.
See?
I don't think they look similar. Like there's a picture of Alex Earl and then some like Asian model. Like they don't look similar to me at all.
Yeah.
But I do think people are starting to, like you said, like beauty trends and aesthetic trends are similar, right? Like the clean girl look.
Yeah.
Less makeup, a little bit more natural looking.
Dark lip liner, lighter lip gloss.
Not full glam.
Not full glam, highlighted, under eyes. Like it makes people present themselves very similar.
Totally.
But I think how I try to ensure that doesn't happen when I do inject is like looking at their existing features.
Sure.
What does their nose look like?
Yeah.
What do their lips already look like, right? And then matching kind of what I do to complement those features instead of trying to change that.
Totally.
Like,
just enhancing what they have.
Exactly.
Yeah.
And so I think when you keep it that way, they should look really, they're going to look really natural because it's going to look like it was meant for their face.
But if they start to look strange.
Here's the thing.
Don't
ask.
Blame?
Oh gosh. If they're starting to request things that I don't think is going to help them, I'm saying absolutely not.
Sure.
Run.
So
Goodbye.
the people that are walking around looking wacky, which we can objectively say. You think so?
I think it's a combo.
Tell
of both.
me why you think it's both.
Because why is the patient coming in and asking for, I don't know, continuing to fill their cheeks in a way that just doesn't suit their features?
Yeah, totally.
Your aesthetic doesn't then match mine.
Right.
Like I want to stay true to your natural beauty.
Mm-hmm.
Yeah, so I think it's a little bit of both. And then why is the injector saying yes?
Yeah. I mean, I don't like I tell this patients, you don't ask for 500 milligrams of antibiotics if your doctor says 750, right? It's not a two-way like discussion.
Yeah.
In the same way, these are cosmetic procedures. Cosmetic procedures are not makeup or hair or nails, right? You might have a preference, but these are medical treatments at the end of the day.
Yeah.
And they sort of like blur the line between like cosmetic things that you can get done and request versus like medical treatments.
Ooh, that
right?
ties in perfectly into the amount of product that's used.
Totally.
And like the result, right? Like some people will think, oh, if I do less, it's going to look the most natural.
Oh, yeah.
Please.
No, yeah, that's not how it works.
Detect.
Yes,
I can see exactly where you've placed that. The thing is, for some faces, more product is honestly going to look the most natural because then it gives me the ability to blend things out to make it look like a part of your existing beauty.
Yeah.
Instead of being like
a blob. Yep.
No,
we've all seen the stuck on chins.
Oh God.
Yeah.
Not a pizza chin.
Yeah.
Please. A pointy chin.
Yep.
Hate it.
Yeah.
Hate it. No.
Exactly.
Or when people try to make things too long or too elongated. Ugly.
Yeah, I totally agree. So what would you say? So if you have patients that are coming in and they're like, look, I saw this trend, or I saw this, or you can tell that the thing that they're asking for is, it might look nice, but it's like a trendy thing. What's your advice? Even if it's something that you think it might look nice, I'm not sure, but you're on the fence about it.
Yeah. Honestly, I think that might be like person to person.
Yeah.
It's a trend for a reason, right?
Exactly.
I think that you just have to take it case by case.
Yeah.
But generally speaking, my patients don't really ask about trends.
Good. That's good.
They don't. Mine don't.
Yeah.
I think that I hopefully am putting myself out there to really show that I'm going to do what's best for you and your face, right? Trends come and go. Like but your face will always be you.
Totally. Yeah, it's the same thing. I mean, timeless. I get the
beauty.
Should I do the cat eye? Like the fox eye?
No.
Like, we're not animals.
Right.
We're humans. We don't need foxes.
No.
We don't need fox eyes. But those things are so big. There's 2 million people will see the same video.
Yeah.
And now they're gonna want fox eye.
Yeah.
And then Bella Hadid will get it, and now everyone wants it.
Right. But then they'll take that trend and over exaggerate that trend.
Yeah. They'll look
and then now people look freaking crazy.
Oh, absolutely.
So I don't know.
So, okay.
Case by case. Why subtle doesn't mean boring.
Okay.
I think subtle is such a beautiful thing.
Yeah.
Again, going back to timeless, going back to undetectable, going back to just truly being in tune with your natural beauty and not changing that. So I think that's not boring at all. If anything, let's continue to celebrate it because that's how we look. That's how we're going to look undetectable.
Yeah.
I'm sorry.
I agree. I think I want there to be a dramatic before and after picture. Like I want my patients to see that, but when they look at the after, there should be no like detectability.
Right.
But I think it was either Disport or Zeem, and they had this catchphrase was just like, everybody will notice, but no one will know. That's just such a perfect one, right?
Ew.
Like people will notice that you look fresher, look brighter, or something looks different about you, but no one's going to be able to pinpoint something. Like that's what you want. It's nice to have a compliment.
Yeah. And like patients just be like, I just still look like me. Like nobody told me, not even my parents. She was like, not even my parents like knew I did anything, or no one asked if I did anything.
Yeah.
But everyone just like complimented me that week.
Yeah.
And I was like, perfect.
Exactly.
Subtle.
It's subtle.
Definitely not boring.
But subtle also doesn't mean, like you said, subtle also doesn't mean one syringe spread out across your entire face, or just one area of Botox. Subtle should mean that everything is sort of playing well together, right?
Yeah, exactly.
All right, everyone. Like, subscribe, follow for more if you want more of this. We'll see you next time.
Bye.